Hi, my name is San. I'm gonna follow you around today.
Yeah, not a problem.
And could I get the SPA patient, please?
Yeah, my patient's Marty Yarn, 80 years old, full code. There's no known allergies. She is a female. She lives alone in a senior housing apartment. Her primary diagnosis is a non-healing sacral ulcer. It's stage 3. She's had this for about 3 months. There is serious exudate, draining with a rather unusual odor. The patient has been treated on an outpatient basis for this ulcer without any success. The patient was admitted from the physician's office into the hospital. The patient also is positive for E. coli. The white blood cell count is slightly elevated. It's about at 12,500 right now, and the BUN is also at a 22. So those are two things that we're going to want to keep an eye out for. The patient's alert and oriented ×3, is aware of what's going on, very cooperative, but just a little slightly anxious. The gait is a little bit unsteady. The patient's experiencing kind of generalized weakness. The patient also has a pain of 6 out of 10 right now, most likely just in the lower back region due to the severity of the pressure ulcer. Also, I want to mention too that the ulcer is 4 centimeters in diameter, and it's a centimeter in depth. The edges are macerated and it's full thickness as well. The patient chest expansion is symmetrical, and it's clear upon auscultation in all fields, but the lower right and left posterior lobes, the breath sounds are diminished. The patient also has a history of dehydration as well as pneumonia. The patient's sinus rhythm is with occasional premature beats. The peripheral pulses are 2+ bilaterally, pedal and radial. The capillary refill is less than 3 seconds bilaterally, radially, and in the pedal pulses as well. The patient's currently on an NPO right now because they're scheduled for surgical debridement. So after 12 o'clock midnight tonight, the patient will not be having anything by mouth. The patient's abdomen is soft, non-distended, non-tender. You can hear the bowel sounds in all 4 quadrants as well. The patient does have occasional stress incontinence with nocturia. Their intake today was 850 milliliters and their output was about 350 milliliters. The patient's vital signs as of 14:15 were a 99.1 temperature, and 88 is the heart rate, 92% oxygenation, and blood pressure was 144/90. The patient is going to be prescribed gentamicin, which is a broad spectrum antibiotic due to the increase in white blood cell count. And the patient's also going to be receiving sodium chloride, just normal saline with potassium. The patient's also on 2 PRN medications, morphine sulfate, and then Percocet or oxycodone mixed with acetaminophen. But the main things we're just concerned with right now are the patient's sacral ulcer, also the pain, and then just the E. coli and trying to get this infection down.
Why specifically is the client receiving the medication?
The patient's receiving this medication because they did test positive for E. coli, but also the white blood cell count is at 12,500, so we want to get that within kind of a normal range between like 4 and 11.
What action does the medication have on the body?
Gentamicin inhibits protein synthesis, so it's really a bactericidal antibiotic.
When should you question administering this medication?
If the patient has like renal failure, breathing problems, or if they have a history of allergies to gentamicin or antibiotics within that class.
Does it have a therapeutic serum level?
It does, 5 to 10 micrograms per milliliter. Above 12 is toxic. Also, before giving this medication a second time, we're going to want to make sure that the trough level is below 2.
Which vital signs are you going to monitor?
I'm going to check all 5 vital signs for this medication.
So which physiological parameters should be monitored?
Creatinine, the BUN levels. I'm also going to check intake and output, check their daily weights. I'm also going to check for any allergic reactions like difficulty breathing, tingling in the extremities, or like ringing in the ears. And I'm also just going to want to make sure that the patient doesn't have any reaction at the injection site as well.
What intervention must be taught to the client to ensure medication is administered safely in the hospitals?
Just that the antibiotic regimen is completed throughout its full course, and also just to know the signs and symptoms of what can happen with gentamicin.
What about safety at home?
It's going to be very similar. Just make sure they know the signs and symptoms, the allergic reactions, just to follow the doctor's orders and to complete the medication regimen to its full course.
What are the side effects and potential adverse reactions?
Ataxia, vertigo, ototoxicity, and nephrotoxicity as well.
How do you know the medication is effective?
I'm going to check the white blood cell count. I'm also want to make sure the temperature is within a normal range, but the white blood cell count is going to be the main indicator to me.
Great, thank you.
Yeah, not a problem. So now I'm going to go here. I'm going to check my patient's charting here. So I have my patient Marty Yarn, 80 years old. It does say she has no allergies. So I'm going to go ahead here and I'm going to check what medications I'm giving. I'm giving sodium chloride, 0.9%. There's potassium chloride at 20 and 2. I'm going to be giving 125 milliliters per hour. I'm also going to be giving gentamicin. I'm going to be giving that IV piggyback, which is 2 every 8 hours. And I'm going to be giving 80 milligrams in 100 milligram bag over 1 hour. So I know my patient, I know my medication. I want to make sure I'm giving it at the right time, which I have here. The route that I'm going to be giving it, as well as the dose. So I want to make sure I have all five of my patient rights. So I'm going to go ahead here. I'm going to pull my medications. So I'm going to check the expiration date on this. I'm going to make sure the clarity is okay, the color is okay, that there's no puncture holes in the back. I'm also going to make sure that this sodium chloride with potassium matches up with this. So I'm going to check the MAR. Everything matches up here. I'm also going to do the same thing with the gentamicin. I have a 100 milliliter bag, 80 milligrams, and I'm going to want to make sure that this matches the MAR. Also, if I have any questions about these medications, I can check my drug book. I can contact the pharmacist or the physician just to see if anything needs to be done prior to the administration of these medications. So now that I have my meds, I'm going to make sure that I have my tubing, and I've got everything pulled out here. So I'm going to go ahead and enter the patient's room. Hi, how are you, ma'am? I'm Matt. I'm going to be your nurse today. I have a level 1 student following me. Could you go ahead and tell me your name and your date of birth?
Martha Yarn, 84 years old.
Okay, do you have any allergies?
No, not that I know.
Okay, great. I'm just going to go ahead and check your wristband here. Okay, so your white blood cell is a little bit elevated, so we're going to go ahead and give you a broad spectrum antibiotic. Okay, we're going to give you gentamicin, and we're also going to give you some potassium IV because the gentamicin can actually lower your natural potassium stores. So we're just going to want to go ahead and give you both of those together, okay?
Okay.
So I'm going to go over here. I'm going to check patients if they have no allergies. I'm going to check their chart again to make sure that they have no allergies, that they have the right patients, that I know what medications I'm giving, what time I'm giving them, the route that I'm going to be giving it, and the dosage that I'm going to be giving it at. So I've got my medication, I've got my tubing here. I'm going to want to flush the IV site, and I'm going to check for any signs of like infiltration, or phlebitis, any irritation or like redness around the site. I want to make sure that the IV is packed. Okay, so I have an IV flush.
Lisa, this is your design. It is?
Now I'm going to clean this for about 15 seconds. Afterwards, I'd let it dry for about half a minute. And I'm going to push probably about 5 milliliters just of like normal saline in here, just to make sure everything is flowing through properly. Did you feel any discomfort?
No.
Push some of that saline through?
It felt fine.
Okay, great. So I'm going to go ahead and put this in the sharps. Okay. So I'm going to go ahead and I'm going to give the sodium chloride. So I'm going to go ahead and type in my patient's, or I'm going to scan the barcode. I don't have one of those, so I'm just going to type it in manually. It's not art. Okay, so I have the green light here, and I'm always going to want to check too, just to make sure that I know my patients, that I have the right medication, that I have the right dosage that I'm giving it at the right time, and then I'm going to be giving it IV as well, right? I want to make sure all 5 patient rates are being met.
later.
So I have the green light to go ahead and hook this up. So I've got my primary tubing here. I'm going to want to make sure that this is clamped off. Okay, I'm going to check the tubing. Make sure that there's no punctures in it. And I've got my bag. I'm going to go ahead and spike my bag. I can hang this up. Now we'll be using a dial flow for this medication. I'm going to be giving this at about 125 milliliters per hour. So I've got this hooked up. Okay. Just gonna make sure I prime my tubing. Okay. I'm gonna want to unclamp this. I want to make sure I get all the air bubbles out of this. We've used this bag over a few times, so it's just may take a second to actually get it to flow through here. Okay, so now that my tubing is primed, I can go ahead and hook this up to the patient. I'm going to want to make sure I set this at 125 milliliters. Okay. So now that that has been all set up and everything's flowing, I'm going to follow the rule of 5 here too. I want to make sure that I see at least 5 drops go through, just to make sure it's all flowing. So I'm just going to document the site that I gave it at, the time that the medication was given. And like any notes, the patient had any discomfort, how much medication I gave. I'm also going to initial it.
Okay. I have 3 more questions for you.
Now I'm going to want to go ahead and just like label my tubing. So I'll label this tubing like with my name, the medication I gave, the amount, and then I'm going to go ahead and initial it as well. So now I'm going to be giving the gentamicin. So I'm going to scan again.
So I have more questions for you.
Okay, so I got the green light here. I know my patients. I know the medication I'm giving, the time I'm giving it, the route, and the dose. I want to make sure all those are being met. And like I said, if I have any questions about any of these medications, I can always contact the pharmacist or check my drug book. So now that I've got this medication, I'm going to check this tubing. I want to make sure this is clamped off, that everything is okay here, that there's no holes. I'm going to go ahead and spike my bag.
There you go, you pass.
Okay. And what I can do is I can hang this up. I could put on clean gloves again. you know, and I'm going to clean this second site that I'm using. Just because it's been exposed to air and I want to make sure that it's cleaned properly. So another 15 seconds here. And I can hook up my secondary tubing, and I can actually bring this down lower, and I can unclamp it, and then gravity is going to kind of take its course, and it will basically just backflow up into here. Okay? So now that I've got this up here, I'm going to lower this bag. I want my primary bag to be lower than my secondary bag. Okay? So now I'm going to set my dial flow here at 100. And I'm going to let this run for an hour, and afterwards I'm going to come back and then I'll change it back to 125 milliliters per hour so that this can finish infusing. Okay? Everything okay? You're still comfortable?
Yeah, I'm fine.
Okay, great. So I'm going to go ahead and do my documentation, do my timing. Okay. I'm also going to want to label my secondary tubing just with my name or just my initials, like the amount that I gave, like the hour that I gave this secondary medication. So I'll go ahead and stick this label on my secondary tubing. I'm going to finish up my med charting. Okay, Mrs. Yarn, you feeling okay?
Yeah, I'm feeling good.
Okay, great. Well, what we did is we're going to give you this gentamicin over the next hour. I just want to go over just a few of the side effects, just to keep an eye out for. If you're feeling like really dehydrated, just to let somebody know. Also, if you have like any tingling in any of your extremities, like hands, feet, or if you have like any ringing in your ears, it's just going to be really important for you to go ahead and let somebody know that. Could you just go ahead and repeat a few of those back to me?
So, any dehydration, any ringing in my ears, or like tingling in the rest of my body, like weakness?
Okay, and also we're giving you some potassium here because the gentamicin can lower your own potassium. So like if you feel, you know, if you're feeling like just generalized weakness, or like if your heart's like beating really, really fast, just to go ahead and let somebody know that as well, okay? If you're feeling extremely fatigued, you're gonna wanna let somebody know, okay?
Okay.
Okay, great. I'm just gonna make sure that your call light is within place. So if you feel any discomfort around your IV site, you know, just go ahead and ring the call light. I'll be back in an hour just to switch this over, okay? Okay, great. I'm going to go ahead and wash my hands again. Do you have any other questions for me?
Yes. Were there any pertinent pieces of information you viewed before administering the medication?
Just the doctor's orders, patients, you know, allergies, like any like pertinent information as to, you know, whether this patient can safely receive this medication.
Does this information affect your decision to administer the medication?
To some degree, yeah. I mean, based on, you know, whether the patient had a particular allergy, you know, this medication, I would or wouldn't administer it, or I'd contact the doctor.
Did this information affect how you administer?
No, it did not.
Okay, thank you.
Thanks.